we're telling you about cholera, that outbreak in the central region. 7 have passed, have met their maker. 47 have been confirmed cases in there, and 720 suspected cases across 8 districts. Now, the Central Regional Health Directorate has stepped up public education on preventive measures against this outbreak. We'll hear from the Ghana Health Service on the measures to contain the disturbing situation. But joining us on phone, we have Asiedu Bekwe, Franklin Asiedu Bekwe. He is a public health director with the Ghana Health Service. Dr. Asiedu Bekwe, a very good morning to you, sir.
Good morning.
It's a pleasure having you join the conversation. What can you tell us about the status so far, the most updated or current information on this development?
Yes, so we've had this outbreak for the past 6 weeks. We started from Ada, East and West. And I would say that it extended to some parts of Eastern country. And then Central. But Central, I think the main district is the Okusina. This is a district that borders Ita. Liverpool, moving out. I'll say it. So,
Doc, please, just if you could move a little and then speak up for me. Our connection is pretty bad. I'd be grateful, sir.
Yeah, so what I'm saying is that we had a challenge at the early stages because people were not sure about the cost of managing cholera. So, typically, if you have an outbreak and it's confirmed as an outbreak, it's free. But at that time, they were not sure that it was free. People would try and self-medicate, and they were having bad cases from everything. So that was one of the reasons why we had an early death from this past September. Out now, there's been a lot of that, and a lot of staff from other Ghana. So what has happened now for the past 1 week? There's a lot of awareness, there's a lot of effect.
Dr. Bekwe, we are struggling to hear you, and I think we try to reconnect with you again, and hopefully when we get you back, you can confirm something I'm just reading in the newspaper about some 9 confirmed cases right here in the Greater Accra region. Maybe we can get him back on the line.
But it's been a while now, sweetie, since I heard about this cholera outbreak.
Yeah.
And, it's particularly ravaging. It can take many lives, and we see that already. Just like the Daily Graphic is reporting today, 7 have been confirmed dead. Yeah. 47 confirmed cases. We are talking of the central region as a hotbed.
Yeah.
But there are other regions also, suffering this. And these are bad times to have such a crisis on our hands. So hopefully remedial measures are put in place quickly.
I know Zoom Lion is fumigating some areas in the Ghana South municipality. I see there's a picture here actually. They've gone to Kokrobite, Botiano, Oshiye, and Meshian 2 weeks ago. And that is where they actually got that case of 9 cases with 3 deaths right here in the Greater Accra region. So the fumigation is part of efforts to prevent the spread of the disease or from going to other parts of the Greater Accra region. But we have Dr. Bekwe on the line with us now, I think. So, Doc, we lost a bit of what you were saying. Could you hopefully start afresh and give us what the real situation is on the ground?
Yeah, so what I was saying was that we've had the outbreak for about 6 weeks now. It started from Adan East and Adan West. And after that, we had other cases, particularly in Central region. That's Taswa, East. And it has to do with the fact that people move in and out of Accra. So the early stages of the outbreak, we realized that people were not sure that management of cholera was free. So people tend to self-medicate. And that was the reason why we lost some cases at the early stages. But now what is very clear is that management of cholera is free. So it's encouraging people to come. So though we have, I would say, a number of confirmed cases, the severity of the disease is down now to us, which is a good plus, because some people should know about it, report, and then hopefully there will be a behavior change that will stop the outbreak. So we have, I would say, for now, Ghana, we have 3 main regions. So that is Greater Accra, Central, and then Western. And I think Eastern has just 2 confirmed cases. So Eastern is not an issue now. But for us, if we have managed an outbreak like cholera, the early stages, you have severity of cases, and then as the awareness go high, you have very mild cases, and hopefully you bring the transmission. So that's the normal trend of managing an outbreak like cholera.
So you're saying basically that it's the lack of education that treatment for cholera is free. That's why we lost these lives. But how much education is actually going into ensuring that, you know, the target audience are receiving the message so they don't self-medicate, like you said?
Oh, so I would say that for now, I mean, there's a lot of awareness going on in the regions, particularly the communities that have the outbreak. So we are using the community information centers. They are having their best. We are working together with NCC and assemblies. So they are using the advance, going around educating people. Because I think the issue clearly, as I said, was people were trying to self-medicate at the early stages. But now, people are coming in. And then we have also had a lot of engagement with the chemical sellers and pharmacy shops. That when somebody comes with diarrhea, don't try and keep any medication. Just refer the person to the health facility. We also engage the private facilities that we can start management by referring to the treatment center. We have set up treatment centers in the public facilities to make sure that we are able to manage the case. So to me, I think that though the case load hasn't reduced much, is the severity which has reduced, which you have is good. And hopefully, with time, we'll get the numbers coming down.
Okay. But can you confirm that we've recorded 3 deaths here in Accra?
Yes. In total, we've gotten, I think, 2 were in Adan, East and West, and I think 1 in Ablekuma, West. And then for Central, I think we've gotten about 7. From Kenya largely, and then we have 2 in West. So those were the outside. Those were the early stages. What is good is that you see people, and I think let me make it clear that because you have established an outbreak, the people can easily move within an hour or 2 to another place.
Right.
There's a threat. So people should be on their guard. Be careful about what you eat. Be careful about what you drink. And make sure they maintain hand hygiene. Because you cannot restrict cholera. That's why we are not restricting mentioned places. Right. But cholera cannot stay in one place. It moves as people move. So let's not restrict ourselves that where are the cases. We have established cholera in Ghana. And for now, the prime regions are, let's say, Greater Accra, part of Greater Accra, and part of Central. But the people should look at their behavior. What are you eating? What are you drinking? What is your hand hygiene like? Are you washing your hands with soap and water? I mean, that should be the message. And if the message is very clear, we were able to break the transmission.
Okay. You've mentioned awareness creation and, you know, just educating the public that treatment is free and they should keep good personal hygiene. What other punitive measures are you, have you put in place to ensure that we're keeping our surroundings clean? Have you reactivated these town council or town, what we call tankers, Benjamin?
Town councils or tankers.
Yeah, have you reactivated them? What have you done? What are you doing to ensure that we're actually mitigating the spread of this disease?
Okay, so I'll say that managing an outbreak of cholera goes beyond health. It's a bigger issue. So it's about water, it's about sanitation. So most of the assemblies, they've kind of they are enforcing their bylaws on open defecation. They're also enforcing their bylaws on good environmental hygiene. So all of the regions, all the districts, is the district chief executive who is heading the response, and it mobilizes the environmental, mobilizes the water, mobilizes the health to be part of the response. We at the health side, we are concerned about management of the cases. When it comes to the education, we do it together with NCC. So it is not just a purely health condition for now. It's a multifaceted sectorial condition that we are handling. And we are grateful for the media trying to help to sensitize the general population. But I think I need to stress that for now, let's be careful for what we are eating. Eat what is. And then if we want to eat something which is not what, like fruit, vegetables, make sure that you wash it well. And then your hand hygiene, very, very important. Make sure they are not dead people. If you want to, then you immediately wash your hands, you soap and water, or use that.
Right. Please hold for Ben. Ben, looks like a decentralized approach where we have the GHS themselves managing the epidemic, while the regional or district level are managing the preventive measures and ensuring that we are keeping our cities clean.
But sometimes it's also the trickle-down effect. Doc, I also know that in the central region specifically, there have been some officers talking about open defecation and its impact on this entire situation. What can you report on that? What is the status and what is being done about it in terms of sensitization?
Yes, as I said, so the assembly are enforcing their bylaws and making sure that, I know for like Adan is like that, and Adan West, they are providing them with some of these temporary toilet facilities. Because if you are pushing for stoppage of open defecation, they need to make sure you provide the avenues for it. So, you see, managing a cholera outbreak has several dimensions. You have the immediate effect, the medium, and then long term. But making sure that we have the good sanitary conditions, making sure they have potable water available. But for now, it's making sure that all these things are being provided as early as possible. But people also alter their behavior, and they make sure that we make sure we eat what is what. I think I've kept on stressing is make sure they eat what is what for now, and be sure that if you are really drinking water, make sure that you have an idea of what the water is. Let me say, 10 years ago, we had a very big outbreak in Accra. And then the outbreak was not the sachet water, it was the handling of it. And I think that for now, we haven't established that evidence. But I always keep on stressing it. That if you are drinking sachet water, wash it that's around it before you bite it. Because you could be the source of infection, not the water itself, but the handling of it. So please, I want to stress that cholera is not a respecter of person. Now the cases are are not mild. The cases are not severe, but we are still not blocking the transmission, and we want to make sure that people have the right kind of behavior change that will minimize the effect of the outbreak. We
also know that when you speak of cholera, you have to look at issues like poverty, because it devolves into poor access to water, like you've mentioned, among others. You have to look at unplanned urbanization. We've been expanding into various places without the right even toilet, water facilities and all of that. We've made mention of some of these. But then there are also oral cholera vaccines. My question is, do we have access to some of these? Are we using them in those areas affected?
Okay, thank you very much. So the vaccines complement, I would say, the physical intervention. So when you have an outbreak, countries apply to an international body based on the evidence that you have. You'll be given some vaccines. So we have actually applied. We're going to get some vaccines. But for us,
just clarify, I missed that. So are you saying you've applied for the vaccines?
Yes. We are actually approved for some parts, because you do it in phases. Yes, and so based on the evidence, so initial evidence was in Adan and that way. So we're going to get that. And now we have applied for, because you cannot just apply that a country. You provide the evidence for them, because it's a global product that everybody wants. So they need to look at your situation and say that you merit it. So for now, we have the approval for Adan and that way. We have also applied for which is yet to be approved. But one thing I want to say that we have
before you go on, how many are we looking at? How many are we likely to get?
You see, I don't like talking about those figures, because it derails us from what we are fighting. Our fight is people should look at their hand hygiene. People should make sure they are eating what people should make sure that if you bring the vaccine in, people will go back to sleep. So that's why we don't want to stress on that. And we want to make sure that the vaccine comes to complement whatever efforts are being put in place.
But you see, it is also important, while I get you, it is also important to know the complement so that we are aware of what we are looking at.
What I want to tell you that, which is a fact, is that Ghana has applied to ICD, and we are getting an approval for some quantity of vaccines for Adai and Adawet. That is a fact. Yes, I don't know the quantities because an issue, then it will about communication. The people say there's a vaccine, and the people's behavior that we expect to change will not change. So for us, we want to focus on the behavior change, not the vaccine. The vaccine will come and complement it.
All right. So in terms of surveillance, we know of some portions in the Greater Accra region. You've confirmed that 3 have passed in the Central region, 7 with 47 of these confirmed cases. Is it localized in only these places? Are there any other places that, not necessarily confirming, but we suspect there could be cases? Other regions?
Oh, so you see, when you have an outbreak, you establish what they call the case definition. So if somebody comes in before they call the acute water diarrhea, it's a suspected case. So we have got pockets of Accra that have suspected cases. They are not confirmed yet. Even if we are across Ghana, there are several areas that have suspected cases. But in terms of confirmed cases, I think in Ghana we have 151 confirmed cases. They have over 300 probable is when you have used RDT. Normally, the definitive confirmation is when you do a quarter. So there are pockets, and to as we have suspected cases, it's good that the several system is working. So it's possible there are no cases. It's possible there are cases. But for us, it tells us that the people are able to report, the system is able to suspect it, which is good for us. But I think that for a whole, if you look at our epicare gives an idea of the spread and the distribution of the disease. You can see that for the past 1 week, it's kind of going down, which is good for us. But to us, we are not over yet. We still want to stress that the Ghanaians or the people living in Ghana must watch what they are eating and what they are drinking. You know, there are countries that have had the outbreak for a year, and we don't want to be in that situation. That's why we are putting our maximum effort. And I want to state that response to cholera is not a health issue. It's multifaceted. It's about water, it's about environment, it's about planning, several things in place. So we should all come together and make sure that Ghanaian is educated and minimize the effect at this early stage, while we can plan for the medium and long-term issues.
I know that in such outbreaks, some of the most vulnerable are children. Of those affected, do you have the statistics on how many have passed who are children, how many have, fallen to the disease who are children? Do we know?
I don't have the data often, but I know the big age band is, I think, between 24 to 45. I think those are the majority affected. The children are not very much affected. Typically, the children, most of them are being breastfed and things like that, so they're kind of protected. So for this outbreak, the children, at the very young age, are not most affected. But then if your mother has it, then you can transmit the bacteria to you. But then for this particular outbreak, it's very low on that age.
And that's an important point you make, the transmissibility of this bacterium, as you put it. What more should people know about it in terms of, people who have cholera and how to, even as family, treating them to avoid picking up the bacteria?
Yeah, so see, cholera is one outbreak that stresses the health, because the time between getting the infection and death, or time between getting the infection and then exhibiting the symptoms, is very short, about hours. So you can be exposed to your girlfriend, your wife, or your mother. Within a matter of hours, you are showing the symptoms. And then when it comes to the diarrhea, it's like a tap that you have just turned on. It's painless and it's flowing like that. So if you get the cholera and you don't go to the facility in a matter of maybe minutes, you can die. So that is serious cholera, and that's why we try to prevent it. So the prevention is making sure that you don't get into contact with the secretions of an infected person. Let's say if your friend or your wife or sister has it, and then you as you try to clean it up, you say you get yourself soiled up, and one way or the other, if you are not careful, it gets into your mouth. You also want to get it. So the key thing is that it's about early referral to the health facility, but then make sure that you protect yourself. So in the house, it's about maybe using a polythene bag or something, because you don't have the necessary protective equipment, but you try to improvise so that you minimize it, and then you wash your hands as early as possible. Once you go to the health facility, you try to put a lot of chlorine to disinfect the bacteria. So those are the measures that we try to implement. So it's about avoiding the contact, but then that is difficult to avoid because it's a relative. So we try to improvise by putting on certain protective clothing, once you try to repair. Normally, when the vehicles come to the health facility, you set them aside and disinfect it before we set them to go. Because there are some instances that you realize people get the infection, the vehicle moves them, the person passes the feces or vomit in, and that becomes a source of infection. So if it's not well contaminated, then it can also cause problems for us. So we set you aside, make sure that you disinfect it for hours before you are allowed to go.
Okay. My final bit to you. So that means we should all sound the word of caution, even if you're in close proximity to these people, our brothers and sisters, you're treating them out of love. Be careful lest you also fall victim.
Yes.
Watch your hygiene processes. But my final bit, which I'm curious about.
Before your final bit, so what we try to do is that when we get a case, a team comes to your household and try and come and disinfect the place. They try and spray there with chlorine and things like that to make sure that all the sources of the infection in your household is eliminated. So we have a team. They're normally afraid. So you have the surveillance guy or the contact tracing person. You have the educator, and then you have the environmental person who comes to spray the house to disinfect. So that's the thing that comes to your house when you have a complaint case.
All right. While I know Sweetie will be coming in shortly, while I know that with such outbreaks, you can't put a real timeline on it in terms of we are eradicating it or trying to deal with the particular situation by this time. I also want to know, per the Ghana Health Service, I'm sure you have some time dimensions in terms of we are hoping that by this time we would have addressed these issues and contain the situation. What are those timelines, if you have any?
For us, we are looking at in phases. So one is to minimize severity of the disease, which to us we are on course. And then before you talk about the degree of infection, the degree of infection can take a bit of some time. But then if they are coming in early and then they are mild, and then people are very much aware. And you see, what is good about cholera is that it has a very short incubation period. So let's say if you're able to get the last confirmed case plus 2 incubation period, so it's 5 days plus 2 incubation period, 10. So we can say that if you have got the last case, that's 10 days, you are off. But it's not that simple. So for now, we don't have a clear timeline. What we are looking for is that we want to make sure that we don't have death. We want to make sure that we don't have severe cases coming to our health facilities. And then we can now look at breaking the transmission.
All right. Sweetie?
Ben, that was an exhaustive line of question. I just want more clarity on the bit about children. I mean, we now know that you said not many children are infected, but what, in terms of your sensitization?
In fact, I think he mentioned from 22 upwards, so maybe no children.
No children
so
at
far.
all.
Right.
But what
not children at all. I said most of them are.
Most of them.
Most of them, right. But in terms of the messaging, I mean, you are trying to manage an epidemic. Have you diluted the message or made it accessible to children? Granted that they are under the care of their parents, but when they go to school, they have the liberty to pick and choose what they put in their mouths and all that. Have you, targeted your message to children as well in any way?
Yeah, so we are working together with the Ghana Education Service. They have clear guidelines that are in the schools. And then they also have made sure that almost every school has hand washing facilities. Okay. So, the children can be also good sources of the information. So they are also being targeted and then we have kind of translated the messages into other languages. That is helping to make sure we get it the average Ghanaian.
Because
so,
I was going to ask you, how about those who don't speak English? Okay, go ahead.
No, I think it has been translated into other countries, other languages. So it's not only English or Twi. The other, Dagbani, Ghana, it's all been done across.
All right. Thank you so much, Dr. Asiedu Bekoe. He's Public Health Director for the Ghana Health Service. Thank you for helping us shine light on this cholera outbreak and what you're doing to stem the tide.
It's a general problem, and hopefully we get it under control. We nip it in the bud soon, because cholera can be fatal and it can have devastating effects on our health. So I'm glad something is being done. I'm very happy, it occurred to me to ask about the oral, cholera vaccines, and the fact that at least there are some expectations. I think he mentioned Ghana West and Ghana East, or one of those in there. So let's see how that goes. Well, mind your health, stay healthy. The times are what they are. You don't want to fall sick, so take care of your health as well. And speaking of health, Medicas Hospital, a modern healthcare facility, has been built with your recovery in mind. They have spacious wards built with your family in mind, a warm and caring pediatric unit, of course for children, built with your children in mind, and they have assembled some of the brightest minds in medicine, led by Dr. Yawasafo, the drive-time doctor, to serve you. They are also offering general medical services as well as specialist services in plastic surgery, obstetrics, gynecology, child health, urology, psychiatry, and eye care. Additionally, they are offering a comprehensive medical diagnostic service encompassing endoscopy, medical laboratory services, x-rays, and scans. And if you're thinking of where to get your medication, you're sorted out. They have a 24-hour pharmacy ensuring you'll always receive efficacious, safe, and affordable medicine. And to cap it all off, they are bringing you the most powerful medicine of all. Do you know? Simple human kindness and empathy. And that's why they take pride in holding themselves to the highest attainable standards. They also accept all forms of payment, including from private health insurance companies. So no matter what your options are, you're covered. Locate Medicas Hospital at number 10 Kinso Street near Shalibutre School Junction. You can reach them on 0501 477 340. That is 0501 477 340. On social media, Medicas GH, Medicas Hospital, a place of healing. Hopefully, we are a place of information for you. This is the AM show. We'll be right back.